This forum is organized by the National Union of Medical and Health Workers in Nigeria to provide training on how to manage Ebola cases without being infected with the virus. Conveners say medical health workers are mostly at risk of contracting the virus. Statistics reveal that since the recent outbreak, over 240 health workers have contracted the virus in West Africa. In Nigeria, out of the 6 deaths recorded, 3 were healthcare workers. Apart from this workshop, members believe there is a need for insurance and better legislature, just as the National Association of Nigerian Nurses and Midwives threaten industrial action. Because of discrimination and poor welfare.
There should be sufficient, incentives, to make people take the, go out there and take the risk, to actually provide the services. We think that government should provide, really robust insurance.
We call on, therefore, the Senate to do everything possible, having taken on board the concern of all relevant health professionals, to make sure that this bill sees the light of the day and is passed into law before the end of September.
They know that in collective bargaining, the best thing to do is to prevent industrial crisis. We have just come out of one. We are not praying for any, and that is why we are optimistic. But in event that this our optimism is shattered, if painfully we cannot resolve to what we are looking for, the National Executive Council of the Association will meet and decide the appropriate action to be taken.
Meanwhile, the National Council on Health on Monday passed a resolution to press for life insurance coverage for health workers handling Ebola cases.
The Council also reiterated that the provision of adequate incentives, including special allowances and life insurance policies, must continue for all health workers involved in the management of Ebola virus disease in Nigeria.
While all health workers are at the risk of contracting the virus, experts believe that those working in laboratories, nurses, laundry and clinical services are at greater risk.